Nicola Hill is 14 years old and seriously ill. Without a liver transplant, she may not survive. 4-year-old Lauren Pluckrose also needs a new liver.
Just a little bit at a time.
Doctors must decide who should be top of the transplant list.
Can you find the syringe? Find it.
If you use the liver for one person, somebody else may die. And that's always a difficulty that we're facing.
Meet the transplant coordinators on Tuesday.
I want to have it to help me get better, but it's just hard.
This man has been rushed into intensive care after attempting suicide.
I'm just registering super urgent and it's on intensive care, paracetamol overdose.
It's up to these doctors to decide if they should use a liver to save him.
We have a very scarce and precious resource in livers that we have to use as best we can. It's always an issue that we're using them appropriately.
These are the decisions that confront doctors dealing with a shortage of livers and the growing transplant list. Decisions that require doctors to place one person's life ahead of another. This is the liver transplant unit at the Queen Elizabeth Hospital in Birmingham. Every year, a team of doctors, nurses and surgeons perform over 160 liver transplants.
Delicate like this,
with donor livers scarce, each case must be carefully considered. This film is about the most difficult cases. A man has been rushed in from Devon with acute liver failure. He is in a critical condition. Consultant Nick Murphy is the doctor in charge of intensive care today.
My view is that his chances of survival without transplantation are very small. I would say that they're probably less than 10%.
Simon Vickers is 53 years old. He has attempted suicide by swallowing over 100 paracetamol tablets.
It's a difficult one. Initially we thought he was under resuscitated this morning. He was on his own in his house. His wife phoned him up and he told her that he's taken a paracetamol overdose. She called an ambulance and he went into hospital.
The paracetamol has critically damaged his liver. Without a transplant, he may not survive the next 24 hours.
Sometimes I don't think people quite understand the potential implications of a significant paracetamol overdose, and they don't necessarily think that it will kill them.
Nick Murphy and his team have just a few hours to decide if Simon Vickers' life should be saved. They must find out why he attempted suicide. If given a new liver, would he be likely to attempt suicide again? The team know that if Simon Vickers is given a transplant, someone else will have to wait.
It's my toes. Go in fact.
Nicola Hill is 14 years old and appears like every other teenager. Two years ago, a dramatic event changed her life.
It was in the morning eating bacon sandwiches and like, go on, eat some, you got to. And I was like, I don't want any. So I went upstairs and I lay on the bed because I felt a bit sick. And I just went to the toilet and I just was sick. It was like a couple of pints of blood and some of it was dark and so yuck. It did come over me, like, I would.
Nicola suffers from a rare disease called autoimmune hepatitis. Her body is destroying her own liver. The damage has disrupted lungs. Nicola needs oxygen to do the simplest things.
Stairs and that makes me out of breath, and walking with my friends and that I have to tell them slow down.
A liver transplant could save Nicola's life, but there are risks. A transplant carries a 1 in 10 chance that Nicola would not survive the first year.
She really wants to be normal and be able to get about and join in with her friends.
She should live the same sort of life as anybody else, be able to run, jump, swim with the rest of them, which she just can't keep up with her peers at the moment.
If Nicola is chosen for a transplant, she will join a waiting list of 30 other children and adults in this region. No priority is given to children.
And so how are things today?
Professor Deirdre Kelly runs the liver unit at Birmingham Children's Hospital.
Hi, Poppy. Sorry to wake you up. What a noise.
With places on the list so scarce, Professor Kelly's team has the difficult job of deciding which children should be transplanted.
Right. Good. Excellent.
In Nicola's case, the disease has gone beyond the ability of medicine to manage it, and she's developed a life-threatening complication. If we leave it much longer, she'll come to the stage where she will not be fit to undergo liver transplantation.
Nicola presents the unit with a difficult decision. They know that a liver will help her in the short term, but may not provide a long-term cure.
She's likely to have a higher risk than other young people of that disease recurring or not responding completely. She doesn't have the standard risk. She has perhaps a slightly added risk of not having such a...
By the end of the week, the team must decide if Nicola justifies a place on the transplant list.
Listen to me, okay? You come here.
On the other side of Birmingham, Wayne Resnick is also trying to get on the transplant list.
He's a good boy. He's a good boy. Come here.
I'd made an appointment to go and see my doctor. My feet were swelling and my stomach had swollen considerably. I walked into his surgery. He instructed me to sit down and immediately called an ambulance.
Bentley, come here. Come here. Come here.
I passed out there, don't remember a great deal for a good few weeks, and lo and behold, I woke out of part coma, part drugs, part sedation, part everything to find out that my liver had collapsed.
Wayne's been admitted to the liver ward at the Queen Elizabeth Hospital in Birmingham. He will spend the week here while the team assess his medical and psychological suitability for a liver transplant.
Hi.
The first part of Wayne's assessment is an in-depth interview about his background.
Good. I've got to take notes, have I? Is there homework?
Oh, there might be, there might be. Do you want to bring your tea with you?
Yeah, it's in my drawer, hang on.
Professor James Newberger will use strict national guidelines to decide if Wayne is a suitable patient for a new liver.
Do you get shorter breath when you walk? I mean, any more than anybody else of your age?
No.
Do you get shorter breath when you lie down?
No.
Every patient is judged by the same criteria.
Isn't it? Yeah. We operate as the so-called 50% 5-year rule, and that is to say the recipient should have a greater than 50% chance of being alive and well 5 years after the transplant. If you're going to be considered for transplant, we need to know a lot more about you physically. It covers really, I think, all those difficult areas. If, for example, they're drinking very heavily, they're likely to go back to drinking, or they're likely to not comply with treatment, then that's going to affect your decision.
Wayne's liver collapsed as a result of alcohol abuse. He is now unemployed and living in sheltered accommodation. His two housemates also have a history of alcohol abuse. Two years ago, Wayne was told to stop drinking.
Thanks to Dr. Davidson was the one who said to me, he made no bones about it, he said, if you drink again you will die. And I've not had a drink since. Not a single whisper. And often the doctors and the consultants are, you must have had a... Look at the blood tests. They don't lie. And I was having a blood test every week. You know, so I mean, if there'd have been, you know, just a minky of alcohol in my system, they would have known.
When you were drinking hard, how much were you drinking?
Probably 3 litres of silly cider a day and a bottle of vodka.
You have to judge each person as individuals. With donor shortage, if you use the liver for one person, somebody else may die. And that's always a difficulty that we're facing at the present time.
Neuberger and his team must now decide if Wayne can be trusted with a new liver. Fewer than 10% of patients who are given a transplant at the unit suffer from alcoholic liver disease. After 12 hours in intensive care, Simon Vickers is stable, but still critical.
You can see the lactate will be... No, and
We're urgently trying to understand the background to his suicide attempt.
We've got a formula that's on intensive care, paracetamol.
appears to be okay at the moment. His jugular venous sats are all right, although I do intend to put an ICP bolt in after the run.
Simon and then will help piece together the events of the last.
It's very difficult to say. Sometimes he does appear to be a bit better, but he reckons it's nothing to do with the medication.
There's a precedent for this in previous colonies and in other countries that are changing sovereignty. And obviously there are some...
Until recently, Simon Vickers had everything to live for.
Administrative service, the chief secretary and everybody runs these various policies.
But then clinical depression took over his life.
It's in his family. He's got a history with his family, and it's very serious. He's always been a very rational and logical man. He's always attempted to explain things rather than just say, well, that's just the way they are, which means that it's that much more difficult to sort of convince him that it's the disease that's making him feel so negative about everything.
For 18 years, Simon Vickers was a senior civil servant in the Hong Kong government. In 1997, he returned to the UK, and depression set in. His illness has had an impact on the whole family.
He's got a great life, he's got a great family, he's had a great job.
Hello, Granny.
No, he doesn't have a reason to be depressed, but he wouldn't say it. He wouldn't see it like that, certainly. Because of the disease, he seems to be on a course for self-destruction.
I rang him on Sunday morning, and he said, I probably ought not to tell you this, but I've been taking paracetamol. But he sounded fine, and he thought he was all right, I think. I said, well, you ought to get yourself checked out, and he said, oh, it's all right, I've been sick or something like that. But I rang 999 and got the ambulance to pick him up.
Should I be allowed to move him or roll him or do his mouth?
Yeah. Does he deserve one? That's difficult, isn't it? This man has a clinical disease, he has clinical depression, which is a treatable condition. We take advice from his psychiatrist and his general practitioner, and we take into account the support he has with his family. We integrate all that information together and try and predict really what's going to happen, and we try not to make value judgments as well.
The unit only transplants 2 or 3 patients a year who have taken a paracetamol overdose, out of a total of 160 transplants. If Simon Vickers is put forward for transplant, he will jump straight to the top of the list as super urgent, and others may suffer the consequences.
It's a bit concerning. How do you justify that with a resource like a liver, which is scarce?